We must release the markets to address demand and need via competition for business. We would allow and facilitate interstate sales of healthcare insurance. Government agencies could gather and publish outcome and performance data for providers so that patients could make appropriate judgments about who to hire for their care. We would facilitate competition among states for providers and patients by encouraging individual states to pursue tort reform, legal liability reform, and by turning quality monitoring and regulation over to the states. We would also publish information regarding the climate of medical care in individual states with respect to liability, professional licensing, quality standards, facility licensing, availability of medical services, and many other factors. What would this approach accomplish for us? Well, first of all, it would accomplish better health. Increased ownership of and responsibility for personal health will lead to a critical improvement of personal engagement in medical care and the chances for success. This approach would also accomplish universal coverage. All of us will have an opportunity for healthcare services through control of our personal resources, public funding, and charitable contributions, as well as a proliferation of insurance products tailored to meet our needs. Everyone would be motivated to arrange and plan for healthcare coverage due to the opportunity to do so on the one hand, but also due to the specter of the refusal of service that would result if they didn't prepare themselves. Full portability would be a natural consequence of this type of approach. A person could move about the country freely without fear of loss of their medical coverage. This approach would also accomplish fiscal responsibility. The program would grow in a fiscally controlled manner. As participation increases, government revenues would fall due to the diversion of tax-free income to these healthcare accounts. Also, public contributions to those in need would increase as public participation increases. However, at the very same time, the federal government would gradually be released from its liability for the unfunded entitlement commitments it bears right now. State governments would also be relieved of their health care funding commitments, especially including Medicaid. Public revenues would be committed according to a budget, period. This is a critically important feature of this approach. This approach would also accomplish a reduction in public and private costs for healthcare. Competition between providers, insurers, and even between the states would lead to a reduction in costs. Utilization will diminish as patients apply themselves more carefully and diligently to their own health care, and providers improve efficiency in response to demands. Defensive medicine and the costs associated with malpractice insurance would also decline. This approach would accomplish an improvement in quality of care as well. Competition between providers and transparency of their performance data would promote development of improved care models and drive providers to a higher level of quality. A heightened engagement by patients in their own care would lead to better outcomes. This approach would also accomplish a greater degree of protection of our liberties. The rights of individuals to make their own medical decisions using advice from medical providers of their choice, free from interference by government or employers or other third-party payers, will be preserved. Additionally, federal revenues will be used more efficiently and according to a budget, reducing the financial burden we will pass on to subsequent generations of Americans, thereby protecting their liberties as well. Why would we not do this, or something like it? Well, some of us expect our health care needs to be met by other people. To those I would respond that we have no right to expect this. Furthermore, a sense of entitlement in healthcare is closely and commonly associated with a refusal to accept responsibility for oneself, disengagement from care, and poor health outcomes. Indulging this type of expectation is not only constitutionally invalid, but it's financially perilous, and it's also bad medicine. Some of us lack faith in democracy and liberty and capitalism. Those who feel that way need to reflect on the fact that these are the foundational principles of our nation, and they are the source of our success thus far. The recent history of medical care in this country is an illustration of the failure we can expect if we continue to steer our nation away from these kinds of ideals. Many will comment that our current leadership is opposed, and we therefore can't accomplish something like this. Our current leadership wants to expand the scope of government involvement in healthcare. Some believe that they don't respect the American people and are dishonestly manipulating public opinion so as to increase their control over us and our dependence on them by enlarging government influence. Indeed, some of these members of leadership claim to be pursuing what is best for us, whether we like it or not. This seems like a cynical perspective, but when they persist in pursuing the expansion of unpopular policies which have proven unsuccessful and destructive in the past, one can hardly be blamed for speculating on their motives. Regardless, we must require respect by our leadership of our opinions and our best interests. If they do not offer this respect, we must accept that we made a mistake by electing them, then replace them and their misguided policies. This system of healthcare that I've described will work for America. As many people have rightly recognized over this past year, the very future of our nation depends on us solving this problem effectively and soon. American enthusiasm, creativity, ingenuity, and generosity have accomplished great things in the past, and these qualities can carry us to success again if we will only release them to do so. Thank you for listening, and thank you for thinking. And thank you for speaking up with your own opinion, especially with your vote.